Hi, I am at 8 weeks post-op rotator cuff surgery, and I would have to say that if I did this video yesterday, I probably wouldn't be as optimistic as I am today. And the reason why is because for the very first time today, I was able to put my own hair up in a ponytail. That is huge. I know men, it's not a big deal. But for women, yes, it is huge. I was my, 2 weeks ago, I couldn't lift my arm up very high at all. And now this is the arm shoulder I had surgery. I can lift it up. Look at this. Look at this. And I can actually touch the top of my head and go back here and put it in a ponytail. Now, it's not easy. It's not natural yet, but I can do it, and that's a big deal. It definitely has been in the last 2 weeks, kind of like one step forward, two steps backwards. Like you feel like you're making progress, and then the next day you're super sore and you hurt a little more than you did the day before, and you wonder, what am I really getting better? But you just have to be patient. You are getting better. You are improving. And when I think about 2 weeks ago where I was, it's, yeah, a lot better. I'm not relying on the sling at all, even to sleep at night. I think in the, like that, after 6 weeks, I was finding I was a little more comfortable still, like putting my arm in the sling when I slept, but I haven't done that. I will be honest, sleeping still is not enjoyable for me. I'm never really comfortable. I wake up a lot. So again, I talk to a lot of people at physical therapy, and there's people who can sleep fine on their backs, no problem. I have to prop myself up on 3 pillows and then prop both arms up, and I'm still not that comfortable. But during the day, when I walk around, I kind of forget about it until I have to move it, and then I feel the stiffness or heaviness, but it doesn't. I'm not aware of it constantly, which I think is very encouraging and a good thing. Driving, like I said last video, I didn't drive at 6 weeks because I was away, but at 7 weeks I drove for the first time, and it went well. I couldn't keep my hand on the steering wheel for very long because it was just too heavy, so I would rest it on my lap. And today I noticed when I was driving to physical therapy that both hands were up on the steering wheel. Like, hey, this is good. It's still, after a little while, I'm still resting it down because, again, it's still not super strong, but it's definitely getting better. So stay with it. It will get better. What else am I doing? I don't have any muscle spasms that I'm noticing back in the shoulder area like I did that first like 4 or 5 weeks in the beginning, which is good. I have more, when I have pain, it's more like in the shoulder or on the like lower tricep area, and also on the forearm, my forearm, like in the by the where you bend your elbow. That's sore, so I was told to massage that. I don't really know why I get that soreness, but all those muscles in the arm now are more sore than they were before when they were isolated in the sling, but you're using them now. I also go to a chiropractor. So some of you would never go to a chiropractor. I'm a very strong proponent. I've always gone for many, many years, and so I actually started going, and I forgot to mention this in some of my earlier videos, but 2 weeks after surgery I went, and he just adjusted my neck, nothing with my back or anything, and that really wasn't until after I was out of the sling, and yeah, it's 7 weeks actually that he did some adjustment on my back and my neck, and that helps open up that nerve, all the nerve pathways into the arm. So that's been a comfort to me. at physical therapy, and I know I've been to a couple different physical therapy offices, and this one I love. They give me heat first before I start my exercises, and then afterwards, if I choose to stay there, I have ice. And the last two visits, they did electrical stimulation while I was being iced to help reduce inflammation. So I like that. My chiropractor has a cold laser and did that on me last week. I'm going to him once a week, so I'm going to go see him tomorrow. And the cold laser is to help like prevent scarring, any scar tissue. So whether it really helps or not, I don't know. But I can tell you it's not hurting. So you always wonder, well, should I do this or should I not? Obviously, you should always ask your doctor about it first. What else? In my exercises, every time I go, which is twice a week, and then I'm doing physical therapy, those exercises at home twice a day. So every day, twice a day, and then going to the actual therapy office 2 times a week. They keep adding exercises. So at first I was there 50 minutes. Now I'm there like an hour and a half. So I'm there a while. I'm probably doing 12 different exercises now. And you're doing things that you don't realize your arm moves that way. You just instinctively move it that way, and so it's good. It really helps strengthen and stretch out everything because your arm has been immobile for so many weeks. But it's also interesting because I ask a lot of the patients that I see, or shoulder patients, their story, and everybody again has a little different surgery. Some, at 4 weeks are already starting physical therapy. Some are like a month, had the surgery a month later than me and can do more than me. So I have to just not get frustrated. Why are they better off than I am? It's just what it is, and I had more work done, and I don't know, my body needs more time, whatever. I haven't been able to go back to work because I haven't been able to raise my arm up to, this level, and now I can. So next week, I go back to work. But that's okay. It's just part-time. So my scars are healing. I do still use lavender on the scars. I'll show you what that looks like this is 8 weeks. So this is the big main one. And there's smaller one. It's pretty flat though. I mean, it looks in this picture, it kind of looks elevated, but they're pretty flat. And then that other one is here. And then I have another small one further back that looks more like this one. I have Band-Aid marks because when I was on vacation and they said not to get any sun on them, so I have Band-Aid tan lines. Okay, so I just want to encourage you to know that it is going to get better, and to not be frustrated when you start feeling like you're making progress and then the next day you don't feel as good. It's perfectly normal. And I just keep telling myself, I know, like, I have to give myself 6 months before I really know that I'm back to the way I should be. I'm not gonna, try to push it. If, in 3 or 4 months, I was told today that I couldn't run until 4 months. So I have 2 more months before I can even run. But I'll just, take it as it comes, and this is, in the big picture of life, not a big deal. So good luck to you, and I will check back at my 3-month mark. Okay, bye-bye.